Good morning, everybody. There are still 4 minutes to the morning. This is Dr. Ashish, and I will be talking about fertility and natural ways to improve, enhance your fertility and your chances to get pregnant ASAP. That's what everybody wants, especially for those who have been trying for some time and the journeys become long and the chances seem to be reducing and reducing further and further. So, what can you do naturally? What steps can you take naturally? What lifestyle changes you can make? Natural lifestyles, holistic lifestyles. There's no point talking about a very idealistic lifestyle which you can't, incorporate in your daily life. And any habit that you cannot do every single day, it's not going to sustain itself. It's not going to last long. Not even going to last probably a week. So that is why it is about holistically keeping those habits together, putting in some changes so that you can have fertility enhancement in the shortest span of time for your health and well-being, for you and your partner. If you are, whoever is listening, if you're a man or a woman, either way, to improve fertility, with natural resources, with your body. How much can you optimize your body? And you can optimize your body a lot with simply being consistent and making these changes in your daily schedule, what we call dincharya, how you live your day. Even with that, you can make so many changes and can enhance your health even without any medicines, even without natural medicines. So that is what I share, I talk about. I support professional women in and around London who are trying to get pregnant and helping them with natural therapies, natural medicines, natural changes. By natural, I also mean holistic, which are sensitive to your body, which are holistic to your body, and you don't react to them. There are no side effects. That's what we want. We don't want to lose health while trying to get pregnant. We don't want to lose a particular part of our mind or our body while we are actually waiting to have a baby. So that is what you can do as well with natural medicine. And that is what I share. I share results of my patients, in the form of various videos and information that you will see online on my channels, on TikTok and every other channel, Instagram, Facebook group. So all these results that I'm sharing with you, they have been tried and tested by me. Some of the things I see as results with the studies that I read and the information that I read, what scientific information is out there that we can use and apply without the nasty effects of it, without the side effects of it. And I am always looking for information that I can use for my patients and my clients in the simplest way. So it doesn't, what is the gist of it? What can we do with natural herbs, with natural therapies, with your lifestyle, that you don't have to rely on medical drugs, pharmaceutical drugs. So you don't have to do that. So that is what I'm always aiming for. I do that with my clients, and my clinic is called Ashishveda. It is in Harley Street, Central London, number 2 Harley Street. So I have shared today, every Friday, I think it will be every Friday, there will be call out to women who are trying to get pregnant, professional London-based women who are looking for in-house therapies and want to do work straight away, working on their health and well-being. 2 fertility accelerator calls that I am giving away, and I actually have got a few people waiting for that now. So if you still want to apply for that, feel free. But you have to be in London and you have to be able to start straight away. And so that is something that I will give away every Friday. So look out for that. If you want to work on your health and well-being naturally. And also look out on my website, which is ashishveda.uk. And there are a lot of activities that happen. And there are more that is going to be happening, all related to how women can enhance their health with the least possible damage to their health. That is my goal for women. for fertility and women's health. So they're interrelated, rejuvenating women's health and rejuvenating your fertility. How can we do that with everything natural? So that is what I will be doing. I am looking to do, been thinking about, actually thinking about, and it is going to come out next week. There is going to be an ebook that I'm releasing for polycystic ovarian syndrome. So that's the first one that is coming out next week. So it is in the progress already, and it is exciting. It may become a full book at some point, because I would love to, reach out more and more with natural medicine to women for all gynecological conditions, because it is possible to improve on those and manage them really, really well with natural medicines. So anybody who has got polycystic ovarian syndrome, even if you have girls around you, nephews, nieces, not nephews, but nieces around you, anybody around you, your friends, even girls who have just started a few years into their periods, if they are the ones looking for that information, or those who are looking to get pregnant with polycystic ovarian syndrome. So I will be talking about all natural steps. This ebook will be ready next week on my website for you to download. So look out for that and check out other information. There are a lot of free resources available, a lot of free content like I'm sharing now. You can ask a question and I will hopefully get through all the questions. But yeah, you can also reach out if you want to, reach out to have a consultation. Mama, favor, can we talk privately? That happens at the time of consultation. If you're looking for one, then do reach out. You can reach out either via the message, or you can reach out via my website. That's when we talk privately. So I'll keep talking in between. When there are less questions or less comments, I will share what I would love for you to know and what I would love for you to do in your fertility health. My ovulation test shows LH surge detected. Does that mean I am ovulating? So when your LH surge is detected, yes, that means you're ovulating. That may also mean, because if you have tested, say for example, first thing in the morning, you might have already ovulated few hours before even that, because there is only set time that you're testing your LH surge. So you also should be looking at your own bodily changes. Are you tracking those, or are you just relying on the strips or the tests? I think there was another question here. Oh, it's the same one. Okay. Thank you for joining. Thank you for popping by. If you happen to see me live, and one of my coaches, he said that I always see you live on TikTok. So that's not the case, but I am live 3 to 4 times a week. It is just, I like having this interaction. I love to know what is happening with your fertility, and I love you to take that away, that naturally you can do so much to change your fertility health and to actually get pregnant. Even only with natural medicine it is possible. I was doing the test every morning and it is just showed this morning. Yeah, that's fine, but the point I'm making is that if you have ovulated few hours before that, LH surge, so you could have ovulated say in the middle of the night, but yes, surge will show that you have ovulated. What causes amniotic fluid to leak during 20 weeks of pregnancy? There could be a number of reasons for that. Sometimes we can't pinpoint the reasons. Normally, it is very, very rare for that to happen. But it can happen with any kind of accident. If you fall down, that is one of the major reasons for that to happen. Otherwise, the amniotic sac in itself overall, when the pregnancy, what we say, it is not strong enough, your hormones are not strong enough to keep the whole pregnancy in. Even then, there can be leak, which can then lead to miscarriage. So yeah, it is coming from coming from the whole how you are living at that point. Sometimes accidents do happen, which is of nobody's fault, but that would be the main reason that I can think of for it to leak. Otherwise, there is the nature has designed amazing, the whole sac, how it just protects and nourishes the baby for 37-40 weeks. It generally doesn't happen, but there may be a specific reason in a particular patient's case for them to have amniotic fluid leak. So what is happening with your case, or somebody for whom you are asking? Lost my baby last 2 weeks, and I'm a PCOS patient, right? So how many weeks was that? Can you still get endometriosis after a full hysterectomy or develop adhesions? Yes, you can. Endometriosis does not go away with hysterectomy or with any kind of surgery that you do. And sadly, surgeries have their own impact on the body, because surgery, whenever you insert a foreign body, like surgeries that we do, laparoscopic surgeries, or instruments that we use for any kind of surgeries, or we use these cameras, they are foreign body to your body. So body doesn't recognize that. And when we are prodding and cutting and doing a lot of surgeries, so body has the mechanism of healing that, and sometimes in order to protect you, it causes these adhesions, and that is one of the side effects of the surgeries that we use for endometriosis. So endometriosis, your body's tendency to have endometriosis doesn't go away after surgery or even after hysterectomy. And that is why you should be looking into improving your health and well-being, so that flare-up doesn't happen, that you don't get to that point where you have symptoms. Even if you have had endometriosis in the past, doesn't matter at what stage, whatever stage you are at, or anybody else who's listening with your endometriosis and whatever else you have done medically, start with natural medicines now. Natural herbs, lifestyle changes, your diet and dietary habits change. They can make, for some patients, they can make a difference up to 50-80% of difference of the symptoms that you feel. Okay, so that is what you should be looking into. I hope you got your answer, but I like to extend it answer for others who might be listening, and not just only one person. 20 weeks already when I had the fluid leak, and doctor requested bed rest. Yeah. Yes, unfortunately, as I said, that fluid leakage is one reason in your case because of which it's really sad. I don't even have the words to, tell you that how you might be feeling. But I just want to let you know, for you, first priority is for you to heal, for your body to get to that point where you can heal your body. And then you should be looking at, from now, you should give yourself good 3 to 6 months so that you can heal, your body can actually nourish itself. And then you should be looking at, if you're looking at getting pregnant again. Have you got any other children, or this was the first one? Right. Okay. Irregular periods. Coagulating, what about irregular periods? Explain your question so that there can be an answer. So this is your first baby after 2 years. Yeah. It is unfortunate. It is very, very unfortunate. And it can be completely random. The leakage of amniotic fluid. Generally, it happens when, as I mentioned before, when you fall or you have some kind of sickness. It's generally due to a shock, because that amniotic sac is very, very robust and it is very well protected inside. So not sure what happened in your case, but you are in that position right now. So heal yourself first, mentally, physically, body wise. Heal yourself first. That would be my advice. I have problem. I face irregular periods. They miss. Okay, so tell me about your health. Good lean core. Tell me about your health. How is your health? How is your diet like? What time do you eat food? What is your weight like? What is your height like? What are your habits? Getting up, passing stools, going to pass urine, any urine infections, what time do you sleep? Tell me all that information and more. When is ovulation? When is ovulation? Ovulation generally is in after periods. When you start your periods, first day, from that point, it could be 10th, 11th, 12th, 13th, 14th, 15th, up to 15th day is quite natural. So it could be any of those days. Thank you so much. Why is PCOS not treatable? I'm tired of taking drugs. PCOS is reversible with natural medicine and natural herbs and therapies. It depends what kind of symptoms you have. You should go to a natural medicine practitioner. I don't know which country you are in. If you're in the UK, you can come and see me. If you are somewhere else, or even in the UK and want to go and see somebody else, look into natural ways of enhancing and improving your health, changing your lifestyle, changing your habits, and what can you do to improve on that. PCOS up to even quite moderate to not very severe, but more up to mild to moderate, is reversible. But yes, you have to change a lot of things about your lifestyle and health. So if that is something you're willing to do, then look into that. Yeah. I was diagnosed with blocked fallopian tubes. Right. So what are my options? Blocked fallopian tubes, medically the options are IVF. And blocked fallopian tubes, naturally there are a lot of therapies that I do in my clinic with my patients, where we try to open the blocked tubes with natural medicines, herbs, lifestyle changes, and natural therapies, particularly with fertility massages and the therapy sessions that I do, and also giving medicine internally in the uterus. So many times those fallopian tubes open up and you might be able to get pregnant naturally. Even if fallopian tubes does not open up, you should still go through all the natural therapies so that you enhance your body. Overall, you can enhance the rest of your reproductive health. And then even if you're going for IVF, then you have better chances of conceiving with that. Those are your options. What is your opinion on the onion cure? What is onion cure? Onion cure or treatment? For what? What would you say to a person that's got into ovarian cyst, the person that has got ovarian cyst? Yeah. Okay. So a big part to be junk. Junk can only be about 5%. You can't have 40% junk and think of your health as being healthy. So that's one thing. So you got to change that. Weight is 74, sleep is not consistent. So sleep has to be on the dot. On the dot, yeah? 10 o'clock, lights off. If you are somebody who takes 10, 15, 20 minutes, half an hour to sleep, then 10:30 you should be asleep. Yeah. So for that to happen, you have to start at 10 o'clock. And if even at 10 o'clock, between 10 and 10:30, your mind is still somebody whose mind is still very racy, you're thinking a lot of things, everything, you think about when you are about to sleep, then you need a sleep ritual. You need to slow down through the evening and then be asleep 10:30. That's the cutoff point. If you want to have healthy hormones, you want to have consistent sleep. 5474 is, so the weight is high. You need to be maximum 65 kilos. So you have about 9 kilos to lose in your case. But it is about healthy habits. So you change your habits, you're going to change your weight. Weight is not should be the focus. The focus should be the consistent habit, so that your periods can then become regular. And then out of your diet, how much is sugar? Some people recommend drinking onion water only for a period of time to get regular periods again. Please don't give these suggestions. It's not correct. It's not scientific, even from natural health point. Yeah. Okay. Is there any herbs you can recommend for your PCOS? How it happens is, in my clinic, you make an appointment. We sit and discuss your whole history, your case, what has happened so far, what have you done, what are your symptoms, how long have you been suffering, everything. And then I will recommend herbs for you, because there are no generic herbs. There is no magic pill for polycystic ovarian syndrome. You may not even need any herb. As I mentioned already, I work with your body. What can we do with your body and with your lifestyle, with your health, how you live your life, everything? What can we change to improve? That is always my first focus, because that is something you can always rely on. And then herbs, if there are any herbs to take. Yeah, that's how it happens. So first step is consultation. What food or herb should I consume? For what? Gulin, for what? Walking 2 kilometers a day, great, that is wonderful, keep doing that. But you also need to know whether it is, walking is one kind of exercise. It only is moving a certain set of your muscles. Yeah, it is not, if you're not doing any other yoga, if you're not doing any breath work, if you're not doing any other stretching exercises, then rest of the body is not moving. It's just a linear exercise that you're doing. Yeah. So you need to look at food. You need to look at the whole thing about your foods. So for that, find a practitioner and go and have a consultation. You can change. There is a lot that you need to change, and it is not that you don't know what to change. It is about maintaining that change that you are going to do, and you have to do that for good 6 months. For 9-10 kilos for you to lose, or for anybody who wants to lose that kind of weight, and for you to keep that weight off you, you need 1 year. Okay, that 1 year is not to lose. You will start losing pretty much straight away. When you work with a practitioner and you do put consistent habits in place, you will start losing straight away. It is for losing that weight and to keeping it off you, and also to keep those habits. Okay, dietary habits are the hardest to change, because they are associated with our moods and foods and emotions and the whole maybe family life. So that is why it is about changing your habits, and that's what you need to work on. And your periods will be consistent. There's no reason why periods should not be consistent if you're healthy. How to increase AMH level? Any herb or multivitamins? Rabia, you need to be working on your diet, dietary habits, foods that you eat, what kind of foods those are, what time you eat those foods, how do you cook them, which kind of foods do you buy, they are organic, non-organic, sugary foods, non-sugary, microwave foods, takeaway foods. All of that will make a difference to your AMH levels, because AMH is one marker to test your egg quality. Egg quality is coming from the quality of your health. It's coming from the quality of your hormones. Your hormones are coming from the quality of the diet that you are taking. Yeah. I'm 7-week pregnant, but no symptoms. Okay, have you had a scan? You can go for a scan at 7 weeks and see the heart beating. It's so beautiful to watch scans at that stage when it's just a tiny little sac. So go for that, check it out so that you are, mentally you can be at peace. Have you had the test? Obviously, you must have had the test so far. Symptom wise, sometimes there are no symptoms, but go and check it out so that you can be mentally relaxed. Yeah. How many days after missed period does the test come positive? Now we have early tests, we have tests that can come positive even 5 days, 6 days, 7 days. Normally it is missed period. From missed period, it should be 2 weeks. That's when your period would come naturally, right? So if you're ovulating, if you have 28-day cycle and you ovulated at 14th or 13th or 11th or 12th, so it's about 2 weeks after that ovulation, if you don't get the period, is when you test. But now we have early testing kits with which you can test if their HCG levels are improving, increasing, and they can give you an indication, okay, you might be pregnant. So that is what you can do. Check it out. I have only one tube due to ectopic, unable to conceive, and 2 miscarriages in 5 to 6 weeks. How's your husband's sperm quality like? Rimpy. Yeah, how's your husband's sperm quality like? Give me the numbers. Okay. Right. So my name is Dr. Ashish, by the way, for those who didn't catch it. And my clinic is called Ashishveda. And website is called ashishveda.uk for those who want to make an appointment, those who want to come and have a chat, those who want to improve their health and want to work on it straight away. We do all therapies and in-person appointments from Harley Street, which is in central London. Harley Street is known for medical treatments. It's known for doctors and all, practitioners to be in one place. It is known for IVF clinics, and it is known for a lot of skin treatments. So there are, it's a medical street, it's full of doctors and medical practitioners. And it is well known around the world for that. So that is where we are. Number 2, Harley Street. If you're looking for an in-person appointment, you can be in any part of the world. If you are traveling to London, if you want to have an in-person appointment, you can do that. I do have patients who come from Europe, from, with few hours of flight is very, very convenient to come, or you might have a family. You might be visiting London and you can come and see me in person. And I also consult and coach online. So you could be in any part of the world or sitting in your bed and still have the advantage of natural medicine. Yeah. So that's what you can do. Do check out more information on here on TikTok, also on Instagram. If that is your medium, you can check out my website, ashishveda.uk. We do have a natural fertility membership. If you do want this advice to be continuously supporting you so that you are not lost in the middle of, and you have somebody whom you can ask a question, a practitioner, then you can join natural fertility membership also. Natural fertility membership can also be taken by somebody who's hasn't really started getting pregnant, but just looking for it and want to keep up with their health and well-being. It's great for those women as well as couples. So even men can join that. So look out for that information. If that is something, appeals to you, you can sign up on my website for that. And next week, there will be an ebook coming out related to PCOS. So polycystic ovarian syndrome, what to do naturally, how to improve and how to manage it naturally. So we'll be talking about that. It will be available next week on my website, right? So, Rimpy, give me numbers. I asked you for numbers. Good doesn't mean anything medically. I'm in Italy. We went to India for IUI, but it was unsuccessful. Here, very difficult to get appointment. It's difficult to get appointments everywhere, whether you are in Italy or in the UK. My periods are normal, 25-day cycle. 3 days periods, only 2 days heavy, but I'm not falling pregnant. How's your husband's sperm quality like? I have high cholesterol. Do I have to take tablet to fix it? There are natural medicines to improve on cholesterol, you know. And I would love to see how cholesterol is affecting your body and your health, and what symptoms are you having, or is it just part of your healthy being? And you can improve on from 7.1, you can reduce it. We don't want to reduce cholesterol too much down, especially for women, because we make all hormones from cholesterol. Most of the hormones are made from cholesterol. So cholesterol is required. Our brain needs cholesterol. It's just that cholesterol, in order to balance cholesterol, you need to be doing other activities. You need to be exercising, and also looking at your diet. What is going on with your digestion? Why is cholesterol high? Maybe you're not eliminating very well. Are you constipated? So that is one of the reasons why, people could have cholesterol high, because your body is not eliminating, your liver is not, flushing it out. So yeah, it's not just only that. If you go to medical doctor, they will give you statins, and statins, we know what happens with statins. It's just damaging for the body. But there are natural herbs you can take. So go to a practitioner, make an appointment, and work with them, and take natural herbs to reduce your cholesterol. AMH is low, 1.8. 1.8 is still not as low. It is low, but you can still have, you can still conceive with that. 48 million. How many motile? What's the motility? Right. So little infection may not be as little. So any kind of infection which has happened, it affects the quality. Wherever you have infection in the body, it will affect the quality of that particular tissue. Yeah. So, okay. So thank you so much for joining, asking questions. I hope you get some answers, some indication, some light toward, if you're looking in the dark and you're wondering what else can you do, or you get some kind of sense, okay, this is the next step that I need to take. I need to go and see a practitioner. I need to go and find a natural medicine practitioner. That is what I would love to see. Do give me feedback. Do let me know if you get pregnant, or you work on my advice and it helps you. Do let me know. It's wonderful to know that it is helpful for those who are listening, because otherwise I'm just talking to the ether without anybody benefiting from it. So that is no good. I had a laparoscopy and they have given me GHNR. What is GHNR? What is GHNR? Is it a medication test? What is it? So I also improved my, knowledge of different countries doing different things, and different medications known by different names in different parts of the world. So it's good to know that. GHNR. Okay. What did you have laparoscopy for, Malaika? So, my name is Dr. Ashish, and I speak about natural medicine. Natural medicine related to fertility and women's health rejuvenation. And I support women, especially professional London women, trying to get pregnant, who have complex histories, complex cases, going through IVF, and maybe a lot more, and suffering emotionally, suffering with mental health, whether they realize or not. I support them over a period of 3 to 6 months, enhance their health, enhance their fertility, so that they can get pregnant faster, healthier, without any side effects, and also they don't have to keep going through the same thing again and again. So that is what I do. If you are somebody going through that, if you're a London-based professional woman and trying to get pregnant and wondering how can you improve your health, how can you improve your everything related to your egg quality, AMH, your fallopian tubes, your ovaries or cysts or fibroids or anything else that you may have, it can be naturally improved. It can be enhanced. Your health can be enhanced naturally. even with simple solutions. So do reach out for a consultation for those who are serious and want to start ASAP. Endometriosis. How does one check for blocked tubes? Cyst removal. Okay. GNHR for cyst removal. Okay, not sure. Getting pregnant, but always end up in painful miscarriage. So, Rimpi, you didn't tell me the motility. If you have the numbers, 45 million or whatever it was, you must have the motility. So for cyst removal, this must be then a steroid injection. I'm not aware, but GNHR sounds like something similar to steroid injection that they give. They also gave that for ectopic pregnancy. So I am assuming here because I don't know. Have you spelled it correctly, or do you have the full name for it? Then feel free to let me know. But it must be that. So what was the question? Oh yeah, okay. So laparoscopy. What was the laparoscopy for? I think that's what I asked you. What was the laparoscopy for? You were testing your tubes. How do you know if ovulation has happened? So one of the ways to know, you can't specifically know if ovulation has happened. That can only be known by scan. To be 100% perfectly sure, can only be known by scan, where we can actually see the egg being released through the follicle. Otherwise, ovulation event, the whole event, your body temperature rises, you have cervical mucus, and you have more desire to have sex. If you have those changes happening consistently every month at a particular time, that's when ovulation is happening. So that's how you know that ovulation is happening around that time. How does one check for blocked tubes? There are 2-3 different ways of checking blocked tubes. Do you have blocked tubes? What about endometriosis? Person who's asked for endometriosis. Laparoscopy was to remove a cyst, and then I was given. So they removed the cyst and then they gave you the injection. Yeah. Okay. Right. So Malaika, what's the question? If they have done that, have they removed the cyst then? Have they shown you? Has it just happened? Have they done any scan afterward to see that cyst has gone? And then the injection must be to, what have they told you? What have they given you injection for? To stop the periods or to make sure that, the cyst, what have they given it for? Okay, thank you for sharing. Thank you for sharing your, medical histories. And also, I hope that you get some replies, some answers which you find beneficial for you. So that's my aim here. And also for those who are looking for, they might not have ever heard that natural medicine can be used for fertility, or herbs can be used for fertility. And herbs can be, or there are natural therapies that can be used to improve fertility or to get pregnant. It is possible. We have used herbs for thousands of years when we didn't have, other medical advances. Medical advances are not bad, or I'm not against medical advance. It is about preserving your health and using medical drug. If you use them together, you have the best result in the shortest span of time without losing any of your health. Can I get pregnant with chocolate cyst? If yes, how? Chocolate cysts can be much more difficult. It depends how big they are, how much are they covering your ovaries, and then to check the symptoms and signs what you have, and then to start taking some herbs, to start doing some therapies with which to, in a hope to release those cysts and to reduce them. So chocolate cysts, as I said, they are harder to release, and also that they are the issue with cyst is once you remove the cyst, it's like a balloon-like structure. and you remove it, and it still has that, in a way, it creates that impression inside your ovary, inside your body where the cyst is. It creates that depression, or that part where the cyst was. So it is very easy for cysts to reappear. And chocolate cysts are very, very difficult to remove because they keep reappearing if you don't change your habits, if you don't change your diet, your lifestyle, and whatever else is happening with your periods. So there is a larger tendency here in which you will have to look at what else is going with your periods and your health and your reproductive health, and then see do natural therapies, do natural herbs for 3 to 6 months to see whether they make any improvement or not. Even with that, you can still go for operation for chocolate cyst if you want, and use natural herbs, in which you will have a better results because you can remove them and then improve your health and well-being. Use them. Yeah. Which herbs are good to take? For what? I think you were talking about endometriosis. Is the same TikTok person. So anybody who asks about herbs, we have 300, 500, about 700, 800 kind of herbs, different types of herb in different parts of the world. I work with Ayurvedic herbs, which are Indian herbs. I also work with Western herbs, which are European herbs, and also American herbs, and the herbs from UK. Depending on how the symptoms are affecting you, there can be number of herbs that can be used for that particular symptom. So how I give herbs, and this is how everybody should be using herbs. You go to a practitioner like myself, you go to a herbalist like myself, you take and have a consultation, you sit and you discuss everything about your health and well-being with that practitioner. And then they can make up those herbs for you. Because the herbs that you buy over the counter are not effective enough. They are not natural herbal medicines. They are like herbal drugs. Like you take paracetamol, they are similar, because herbal companies take out 1 or 2 chemicals out of the herbs, and that's how they are making those pills and using them over the counter. And the reason that they are over the counter is because the dosage is very, very small. So the dose is not effective of those herbs. And that is why you need to go to a practitioner who can actually then supervise you, also work with you. You may be taking other supplements, you may be taking other diet which might be interacting with the herbs, you might be taking other drugs or pharmaceutical drugs which might be interacting with your herbs. So all of that has to be looked at, and then herb has to be given to you. So this is how you should use herb. So if you want me to give you herbs, you will have to come and see me for a consultation. You can go and see another practitioner for a consultation and then take herbs. Don't just take herbs because your neighbor took it, or your cousin took it, or somebody else took it and they said it has helped them. It might have helped them, but it's not a guarantee that it is going to help you, because everybody's health is different. I used homeopathic herbs from a lady called, in London for eggs. Another problem, but didn't work. Sure. Homeopathic remedies also work greatly for a lot of patients, and it's with everything. It may work, it may not work. You may not have used it long enough. Natural medicines have to be used long enough, and have to be used with your health and well-being. So there can be a lot of factors why medicines don't work, or natural. It's not nothing is ever is like so sure that it is going to work for you, because your health may be at a different stage. So if you're using homeopathic remedies or natural herbs, for example, depending on where your health is, and that is why I'm saying go to a practitioner. For those who are asking about herbs, go to the practitioner. Sadhkor, it is like that. You may have completed all the courses. Like IVF doesn't work for everybody, right? So you complete all the course and it still doesn't work. So you have to do the course again so that it can work. Or you try some other natural medicines that can work for you, because sometimes one way of dealing with your health, like homeopathic remedies, may not work with your health. So you may have to use natural herbs, natural therapies in a different way. Yeah. And homeopathic remedies, you obviously didn't do the therapy work. So a lot of factors. Yeah. It is not a practitioner's fault. What is the best hormone therapy to have to control endometriosis? Mirena coil. It doesn't control endometriosis, but yeah, you can use any kind of coil. Hormone therapy. Endometriosis, it is not even masking the symptoms, and coil doesn't suit everybody. So you may not be helped at all with that. So, TikTok person who was asking about the endometriosis, did you understand the answer I was giving you about the herbs that you were asking? Go and find a practitioner to work with them. Don't just use guesswork with medicines and with natural herbs, only because natural herbs are not going to give you a major side effect, but the fact that it will be of no use for you to take. So that is why you want to take it with somebody who's qualified and have actually worked with patients and then can give it to you. Yeah. So I hope that answered, you understood that. Yeah. I'm always bleeding. Why is that? Why are you always bleeding? Manpreet Anand. I have no idea. If you don't know about your health and well-being, but if you're bleeding constantly or continuously, then you should go and get it checked. Have you got it checked? Where do I go find a herbalist? Google it. Google. Herbalists, there are a number of practitioners here in the UK. We have a National Institute of Medical Herbalists in the UK, which have got listing area-wise, region-wise. We also have Ayurvedic Practitioners Association. We also have Ayurvedic therapists listed there and practitioners listed there, like myself. So do check those online, find the practitioners that are in your area who are herbalists, who are qualified herbalists, and then go and see them. You've been checked, went for scan, and then what happened? I had 2 miscarriage. One is 17 weeks, the other one is 5 weeks. Any particular reason? What was the reason, such they were saying, what was the reason given to you by your medical doctors? Where are you? Which country are you connecting from? I have PCOS and I'm trying to have a baby for over 1 year and still can't get pregnant. Okay, so how is PCOS affecting you? Where are you based? I am based in central London on Harley Street in the UK. Where are you based, Sadhguru? So yeah, Manpreet, you went for a scan. What did you check in the scan? What was checked in the scan? Yeah, Lincolnshire is in the UK. So yeah, I do online consultations. I do coach and consult online as well. So, or otherwise, you can always travel to London. I have irregular periods. So again, I have replied to somebody else. You might have joined later. What to look for irregular periods? You have to look for clues in your health and well-being. What is going on with your health? Your diet, nutrition, your lifestyle, exercise, everything else. Nothing comes up, but GP want to see me. Manpreet Anand, if you have been bleeding, what kind of bleeding is it? Explain to me. But if you have had bleeding which is not at the time of periods and you are bleeding in between or you're constantly bleeding, there has to be a reason. Okay? And it is not, it is quite worrying if you are constantly bleeding. So yes, it is advisable for you to go and see your GP. If they have done the scan, they probably haven't given you the results of the scan or haven't told you, but you can ask for scan results. It generally has a report on it. Otherwise, you can ask your GP what is the reason, why is that happening. So what kind of bleeding is it? How other ways polycystic ovarian syndrome is affecting you? You are not overweight. Okay, that is not the case. So what else? I had miscarriage in 2018. Since then, didn't get pregnant. How can I regulate my periods? By regulating your health. So I was asking about your health. Do irregular period link to skin problems? Absolutely. Yep, direct link. Because irregular period means hormones are irregular. Irregular period means your gut is irregular. Irregular period means your thyroid is not balanced. Irregular periods mean your liver is not functioning very well. So yes, it will have an impact on your skin. Okay, thank you. I think we are done for today. Thank you so much for sharing. The main message that I want to tell you is that don't take herbs on your own because you are not a practitioner. Unless you are, then great, keep taking them. But if you are not a practitioner, then don't take herbs recommended by your friend or your relatives. Go and see your practitioner who is qualified to give you herbs, who is qualified to give you natural medicines, who is qualified to give you natural therapies, who is qualified to do those things for you after assessing your health. I would be very worried if I go to, I would be very worried if without discussing any of my symptoms, if somebody says to me, okay, take this pill, it's going to work for you. How would that work out? So please go and find a practitioners in your area, whoever you trust. If you want to see me, come and see me, book a consultation, and we can sit and discuss your medical history. You can do that online, offline, in person, however you wish. That is possible. Otherwise, find a herbalist, find an Ayurvedic doctor, find a natural medicine practitioner, find a natural therapist who you trust, who you like, and then work with them. Start your journey with them. Okay? Don't do it without somebody's supervision. So that's my takeaway message for today. You have sleep issues. Okay. I am petite, lost weight. My lifestyle is good. My health is good. I don't eat junk. Okay. Yeah. So Manpreet, do get it checked with your GP first and then let me know. Right. So thank you so much. Yes, for those who are looking for, who want to do more work and want to work with a practitioner, if you want to work with me, then you can check out ashishveda.uk and book a consultation. You can send an inquiry and then we can chat and have you booked in for a consultation. Yeah. Thank you. And last question, my test results were pregnant, but now it's negative. Right. So you should go and have blood test and finalize it. They might do a scan depending, or they might just wait in case it is a miscarriage. Unfortunately, they will just wait for you to bleed or start bleeding. And if it is still positive, they might do another test. And if it comes out positive next time, then they might do a scan to finally check it out whether pregnancy is still there or not. Yeah. Okay. Wishing everybody a great Friday. And I will see you soon. But do check out information that I share. There are lots of videos. There is a lot of information in those videos and in those everything that I share. Take that on board. Put it into action. Don't just sit with the information. It is not going to produce any result without working on it. So start working. Even if you start from one aspect of your health, start working on something with natural resources, natural medicine. Yeah. And then we'll talk more next week. Thank you so much. Bye.